Today I will be assessing the single leg squat with knee valgus. Here we see the patient is having trouble with the single leg squat and has to compensate by adducting and internally rotating the knee, more commonly known as knee valgus. There is also hip hiking, but today we'll be focusing on knee valgus. From a lateral view, you can still slightly tell that there is knee valgus and the patient is having trouble completing the activity. From a posterior view, it is still very apparent that the patient is having trouble and that the knee moves inward and the hip is still hiking. Knowing the client is compensating by using knee valgus, we can come up with overactive and underactive muscles. Using the corrective exercise continuum, we can target these overactive and underactive muscles. We will be looking at the adductor complex and how it is overactive during this exercise. To begin, we have the inhibition phase. To inhibit this overactive muscle, we can use myofascial release techniques. By using a foam roller, we can roll out the complex and release tension. If you do not have a foam roller, you can use a tennis ball. To begin, you should place the foam roller or tennis ball on the adductor complex and slowly begin to roll out the tense muscles. The next phase in the corrective exercise continuum is the lengthening phase. This can be done through static stretching, dynamic stretching, and PNF stretching. One way to stretch the adductor complex is to be standing in an upright position, one leg slightly in front of the other, having the heel aligned with the toes, and bending at the knees and extending the hip. Basically doing a side lunge. To do this, you do both legs 5 times each for 3 sets. The third phase of the corrective exercise continuum is the activation phase. Here we activate underactive muscles, and the muscle that I chose was the gluteus maximus. You can activate this muscle by lying prone on the ground and slowly extending and slightly adducting the hip. The knee in this exercise should be locked up. Do this on both sides and hold for up to 30 seconds to get the full activation of the gluteus maximus. The final phase of the corrective exercise continuum is the integration phase. This is done by using total body dynamic exercises that are slowly progressed to coordinate and solidify changes made. An integrated assessment for single leg squat would be to do a lunge while having an overhead press with dumbbells. The weight should vary on the patient and how prepared they are for this assessment. Doing 5 lunges per leg should be enough. This can be progressed by having the patient do a single leg squat with an overhead press. Be careful, as this is an advanced technique and should only be done if the patient is ready and you can tell that their form is good enough and then they have enough strength to complete this exercise. During all the phases, make sure your client has correct form. This was my corrective exercise assessment of the single leg squat with knee valgus. Thank you for listening.